Hello everyone. I am Eszter and I would like to present my PhD topic, that is the link between cognitive trainings and neuroplasticity in mild cognitive impairment. I've studied cognitive neuroscience, and I am working in a neurocognitive research center that is led by my supervisor, Translational. And also I'm doing my PhD studies here at the Translational Medicine Center. My SMS is Mari, and my vision is that all preventable dementia cases are prevented, and my mission is to evaluate cognitive trainings to delay or prevent dementia. So in order to achieve this mission, we specified two goals. The first one is the investigation of cognitive trainings in adults. It will be a systematic review and a meta-analysis. And the second one is the advancing initiatives of dementia risk reduction. That would be a survey. And about my first project. So dementia is on the rise and will affect 139 million people by 2050. There is no cure yet, but different lifestyle interventions show promising results. A recent study showed that at least 40% of all dementia cases are linked to modifiable lifestyle and environmental factors. One of these lifestyle interventions is cognitive training, and there's a wide range of cognitive trainings, but their exact effect, especially on objective neuroparameters, are still unknown. So our clinical question would be, how does cognitive training influence structural and functional network connectivity and metabolic changes in the brain? The population will be adults. Interventions are designed and validated cognitive trainings, and the comparator is no cognitive training, and the outcomes are objective biomarkers of cognitive risk, like MRI and PET data. We hypothesize that cognitive trainings have a beneficial effect on the brain compared to no intervention, and if this is true, we could be using objective measures to design better cognitive trainings, as well advise people at risk of dementia to take part in cognitive trainings in the future. We did our systematic search in 3 databases on the 30th of November. You can see the search key there. The first domain is cognitive trainings, and it's different kinds of synonyms. And the second is population, and the third one is the outcomes. Here you can see the flowchart of selection. We had 6,134 hits of the search, and it remained 4,777 after the duplicate removal. We just started the title and abstract selection, so there is no data on that yet. And about the second project is advancing initiatives of dementia risk reduction. As I mentioned, it will be a survey. Behavior change interventions are poorly understood and not developed systematically. And we know that compliance is dependent on how well people involved in dementia care work together. And there is a shift towards personalized medicine that could lead to improved quality of life and health and disease-related behavior. So our clinical question in this topic is, what are the components of priority of prevention for patients, clinicians, and caretakers? The population would be anyone involved in dementia care, clinicians, caregivers, relatives, and patients themselves. A factor would be different kinds of social factors of importance, and the context is primary, secondary, and tertiary prevention. We don't have a hypothesis, but this survey could help us design better intervention and communication strategies and to improve adherence and compliance. We are planning to use to organize a focus group like the European Working Group of People with Dementia. We'd like to include healthcare professional, patients, and informal caregivers, and we would like to use surveys like this one that you can see there. And to summarize, my first project is about the investigation of the effectiveness of cognitive trainings in adults. And the second project is advancing initiatives of dementia risk reduction. We are planning to submit these both next year. And I would like to thank your attention with this quote of Aldous Huxley, that systematic reasoning is something we could not, as a species or as individuals, possibly do without. But neither, if we are to remain sane, can we possibly do without direct perception, the more unsystematic the better, of the inner and outer worlds into which we have been born. Thank you.
Can you tell me something about how you want to analyze the data from the focus groups?
Well, there is, as far as I know, a survey analyzing, I don't know how to call it, website that would help us, actually. Not that in that detail. First, we have to see what exactly we are doing to it.
And what kind of key topics do you expect from these focus groups?
Well, we are planning, for example, to assess the communication between clinicians and patients, or what would be the patient's priority in these behavioral interventions. For example, time management, if they would want to do it at home, like a computer-based cognitive training, or come here in a clinic, or something like that, this kind of.
Thank you.
Thank you.
First of all, sorry, I have to say this. You have a great language skill, but still you are so stressed. And you are crossing your legs all the time, so please focus on that. Be straight when you are presenting. I was just wondering that how are you going to handle the different baseline populations in your meta-analysis? So I assume that those studies that you will find include different population.
Yes, we are planning to do subgroup analysis for MCI patients and healthy, or, well, not demented patients, and we'll see how much other subgroups we can do. For example, subjective memory decline and this kind of populations.
Can you please tell me more about those cognitive training? How can I imagine them? If it's something on mobile phone, how you can train, or how it is done? Thank you.
Yes, thank you for the question. There's really a wide range. So there's a lot of types of cognitive trainings, but these exist, yes. That you can also have like playing kind of games on your phone, on your computer, or you can use these are different kinds of visual techniques to memorize things. Actually, there's a lot of types, so I don't know, I wouldn't.
And how long does it need to be performed to be somehow effective, or for the first project?
That actually also is a question, because I found projects that use, I don't know, 2 weeks of cognitive trainings or half a year of cognitive trainings. So that's really different kinds of cognitive trainings. That's why we want to do the meta-analysis, because there's so many different types that we want to see what is good. Thank you.